Good afternoon, everyone. Do you have a good lunch? The spicy veggie wrap was delicious. Well, I hope you wake up, put your arms out, stretch, kind of turn your head sideways, do something to wake up and get out of the sleeping mode. Thank you for having me. My name is Denisa Livingston, and in Navajo we say Yahat'e, which means all is well. And I'd like to thank the National Academies of Sciences, Engineering, and Medicine. And also I'd like to thank First Nations Development Institute for connecting and linking us for me to be here. I am from the Navajo Nation. I am Diné, and I am from the Four Corners area. And so I have a lot of information for you in a few minutes, and I hope that I'm able to cover as much as I can. I'm really covering years of work and trying to advocate for our people. And we've been referred to as the Soda Tax Warriors, hashtag Food Rangers, and also hashtag the FBI, the Fry Bread Investigators. We know that food is not only a material pleasure, but it is healthy food that is our tradition. And the group that I represent today is the Diné Community Advocacy Alliance. We are a grassroots organization. We have raised money to support our community, to raise awareness about what I call hashtag diabetes and obesity. And I've been a volunteer for several years, except for the first 6 months of this year. And I continue to have the mindset of a volunteer and also to be passionate about what I do. And so our organization started formally in 2012, and we continue now even to work on the laws and policies that we've passed. Some of you have probably heard about our work. We've been hijacked by the food industry, the unhealthy food industry, and we have a 99% food desert. 1 out of 3 of my Navajo people are diabetic. Every Navajo family is affected by this, and this is the reason for our work. This is what has propelled us to do what we do and to continue to do it. And so in Navajo, we have a saying, it's Shana Dani Glingo As'a Nel Teto, and that means let's live a long life. So as difficult as it may sound, it's just as difficult to implement. So if everyone, you want to say this, please you're welcome to say it. We are hungry for change. And this goes back years since the federal government sent my people to a concentration camp of Bosque Redondo in New Mexico. And there at the concentration camp, after they took their livestock and burned their crops and took everything from them, they introduced salt, sugar, and flour, and canned meats, which to this day we're still fighting. We're still trying to address that prison food. And so our advocacy is really to empower our advocates, to empower our people, to take that responsibility to address our health issues. And so we raised money through one of these examples here is the Healthy Diné Nation Zumba Tour de Res. And so we went around the reservation and we did Zumba, and we raised money, we raised awareness about what we were doing. And this summer we are going to have another Zumba Tour de Res. If you are in the Four Corners, you're welcome to join us. And so really our work has been based upon these areas here and having a voice and allowing our community members to be seen as assets rather than liabilities. And for me to stand here and to be supported by my community, just like it takes a community to raise a child, it takes a community to raise a community advocate. And I'm very passionate about this work. And what we've done is really address policy and legislative changes. Our goal is to move from hashtag food desert to food oasis. And our work has been very political. And these are the 4 areas that we've been able to address. And we started back in 2011 when the community advocates, the members of the community came together and said, we have to address our food desert. We have to address this unhealthy food culture. And we have to start creating a healthy future. We expect healthy future generations. And so what we did is we introduced this bill 3 times. Some of you know it as the junk food tax. It was the first in the nation. We were the first community-led referendum to succeed at this level. and we went to introduce it as one bill to eliminate tax on healthy food, and that failed. And so we took the bill apart, we introduced it separately, and our former Navajo Nation president vetoed that. We went back again to introduce legislation to override his veto, and that failed, but the elimination of tax on healthy food, that passed. And then we went back again to introduce the bill, and this time we had introduced it as the Healthy Diné Nation Act. And so this one is elimination of tax on healthy food, and really these 6 categories at that time, and even now we have a 5% tax, or even then we had a 5% tax on healthy food, and most people did not realize that. And according to Forbes, we have areas on our reservation have the highest tax in the townships of Kayenta and also Obesity, which can be from the Navajo Nation tax, including their township tax, and also our unhealthy foods tax, some of them between 11% to about 13%, even more. So we eliminate tax. We had people going to the neighboring towns, purchasing food tax-free, and the main area of this healthy foods tax law was to really put an emphasis on our cultural foods, really put emphasis on the ethnic foods that they'll be able to buy that tax-free. And so I brought some posters here, and you're welcome to take a look at them, some books here, really talking about those foods that empower us, that make us strong, that strengthen us. And so some of the other items that we have from other areas too are like wild rice. Being in New Mexico, we have a lot of good New Mexican food. All of the New Mexican spices, the chilies, all of those are also tax-free in addition to our own cultural foods. So the Healthy Diné Nation Act, this is quite a journey, communicating with different health professionals and dietitians across the country, and debating the issues about junk food. And we originally introduced the bill as a 7% tax, and we received criticism from public health professionals. Said, Denisa, what is a 7% tax going to do? Even now, what is a 2% tax going to do? You need about 15 to 25% to make an impact. And we have a ceiling of 7% on the Navajo Nation, so we decided introduce a 5%, increase it every year, but that failed. We finally settled with our Navajo Nation Tribal Council for 2%. And so in some areas, you're paying the 5% tax plus 2, which is now 7% in most areas, except the townships where they are paying more. And so this bill became something that was very successful in raising awareness of unhealthy foods. The biggest success of that 2% was raising that awareness that we live in a food desert, and we had to have conversations with our elders, with our community members, because there's nothing in Navajo that meant junk food. This wasn't part of our culture, hasn't been part of our heritage, and so we talked about this, and to communicate that and to get support from the elders, we had to talk about a term, and we came to an agreement that the term would be Ch'iyan Bajol. And Ch'iyan in Navajo means food, but Bajol means the scraps, the leftovers, the non-nutritious pieces. It means all of those negative terms. And so many folks have said, Denisa, you cannot use junk food. You cannot say junk food. There's junk and there's food. There's a difference between that. And the more research that I was doing, there was no scientific definition of junk food. I mean, it's ever changing. The demands are changing, and the industries are creating foods that are healthy. And so we decided we cannot use milligrams of sodium, of sugar, and so forth. And we did, in the beginning, use that in our law, but we took that out. We went to minimal to no nutritional valued foods. And so these are the areas that our bill covers, and the list of this food, these food items are about 6 pages long. You're welcome to request those, and we had to write the definitions out about what is a soda, what is energy drinks, what about fruit juices. We had to create all the definitions, and that includes all of the areas in retail areas across Navajo, whether that's the casinos, the restaurants, the fast foods, the convenience stores, the pawn shops, places that sell food. And so there's many retail areas that should be integrating this law and should be in compliance. So much criticism came from the 2%, but we fought hard. We believed in our cause, and we continue to do so and to address this. And So the 2%, to this day, we've raised 2.6 million, and that's at half compliance. And so it's been very critical to see this money going back to the communities. And this is the flow of where the revenue goes, and it's collected from the consumer as a sales tax and goes all the way through these different entities. And we have on Navajo 110 chapters who will receive this money. And so we thought we were done with the bills. We had to create a fund management plan to ensure different projects will be funded, supported, and to advise of what kind of projects that the communities can apply for. And most people say, Denisa, this is a dream list. And this is my grandma running in the Shiprock Marathon, which is the famous marathon. And it's such a wonderful image. And so we created the fund management plan, and these are really the key areas of what the chapters can use the money for. And this is something that can stem from the people introducing their own projects and not us telling them what to do or how, to go about their projects, but really to address their own needs in their communities. And so the list includes everything from equipment to biking trails to walking trails, even traditional craft classes, traditional healthy cooking classes, contemporary wellness workshops, whatever that the community needs and whatever that they think health and wellness is to them, we really wanted to integrate that. Using horse therapy as well, having a health library, having access to resources there, farming and gardening initiatives, and also recycling and clean water initiatives, and emergency preparedness, or even other projects that may already exist. And some projects in one community, in the Navajo Times recently, one community of Kayenta, they received $50,000 from the tax, and they had a matching fund from the executive branch, so they were going to create a walking trail. And so all of these different things are at the dispense of this money, and also allowing the community members to take the control over their social environments and their physical environments. And so we thought we were done with that. But then we had to create a distribution policy for all the chapters to know the process on how to receive that money. And basically, they have to create a resolution. They take that to the local chapter to get that passed. But really, it's something very simple. It's not a grant application, but they can state whatever objectives that they can state, and also have a small plan of how this money would be used. And in some of our advocacy, going to the tribal council, we created some items, that had healthy food in there. We cook healthy soups and salads, and really got the tribal council motivated, to say, hey, it's doable. We live in a food desert, but we're creating fruit-infused waters, and we're the first group to do Zumba in front of the council chamber. I mean, we just went all out, and creativity is just such an amazing thing to explore when you allow it to take leverage. And so these are some projects in the township of Kayenta, and tax is not something new to us. We know that we have gotten a lot of criticism about it being a regressive tax, but I've been arguing that it has progressive benefits. And so it is something that is key for us to address. And Michael Pollan once said in his Cook series that we can't afford the food that we are eating, and referring to the unhealthy processed food, the junk food, the cheap food, the oppressive food, the fast casual food, or in Navajo, Ian Bajol. And we can't afford the heavy price that it comes with it from the value menu. We can't afford cheap food because we're going to pay the consequences of dialysis centers, stomach stapling, of healthcare costs, and the consequences of unhealthy eating. And so it's something really that we take to heart every day that we do our work. And so these are the agencies across Navajo. We're the size of West Virginia, with about 11 grocery stores. And so people drive hundreds of miles one way to get food, to buy food. And so we're trying to address the needs in all of these different areas. And you're welcome to come visit our Navajo Nation to see the reality of it. We had a lot of news coverage of it from TV Tokyo to people coming from, even from LA Times. It may seem like it's a shorter distance from there, but they wanted to see the reality. They said, Denise, I got to see this for myself. And so you're welcome to come. The biggest advocacy part is us as community members, that we are exposing and allowing our tribal members to be a part of every area. And this was a message to our tribal council, because it was the first time that a grassroots people were coming together and authoring legislation, writing legislative petitioning, and getting all of these resolutions and just raising awareness about this. And so we really created a different mindset over the years in educating them that we are going to actualize it, that we initiate, we're going to actualize it, we're going to go forth. And so it's something that is very critical for all of us to experience, and also to allow our community members to be a part of the process. Here are our champion tribal leaders. It's a different conversation now, because we've brought a different message to our tribal leaders that we believe in them. Instead of bringing negativity or talking negatively about them, or not wanting to approach them, or have this, someone said earlier, sustainable relationships. We have to have those sustainable relationships. We have to be positive. And so we really work with these key areas, Mr. Danny Simpson, Mr. Jonathan Hill, and now our current Vice President, Mr. Jonathan Nez. And so these gentlemen here are the future of our leaders as well. They're young, and we are continuing to work with them, and they have personal testimonies as well, that they're eating more healthily, they're buying more water. Our Vice President runs marathons. It's really changing that mindset even in the leadership. And so this is something that's taking off, and one of the key things is that we told our leaders that they have the opportunity to empower us. They have to make a decision. The whole world is watching them, and we see different areas, like in the Pacific Islands, we see across Indian country, wanting to create policies and maybe do executive orders to ban all tribal funding on soda. I know one island in the Pacific, they want to ban all junk food imports. And so, these are critical matters, that are allowing us to prosper in the midst of all of the problems, and it's switching that negative mentality to a positive mentality. And so one thing that we uncovered dealing with other municipalities of Berkeley, of different areas that are introducing sin, fat, or soda taxes, is that we uncovered that as Navajo people, we have the right to be a part of the legislative process. And this was very important, because we were told we weren't allowed at the tribal council. Why, as young women, as young leaders, that we should not be there. Why are we there? Why are we, working on these? And we were stepping on, the leaders' toes, like they're the ones that's supposed to address policy. Said no, this is coming from the people. And so we also had to advocate with them that it's their responsibility to protect and also to serve us. And it's their duty. We had to remind them, and continuously, and many people did not know about our fundamental laws, and in practicing our own tribal sovereignty, and practicing our own right, to govern ourselves, and also, to initiate laws and policies that matter to us, and instead of, other programs coming in and say, this is what you need to do, we said, this is what we ought to do. And so at present to the future, it wasn't until recently, and this is a challenge to funders, that we need to be seen as tribal citizens, and empowered people worthy of an investment, instead of being seen as risky. And for years I've been advocating, and many people have asked, so what is the evaluation? Have you seen an impact? Berkeley and Mexico have had their evaluation, got criticism over that, but we're not getting any support regarding funding. And so we know that 3% of the funding goes to indigenous people across the US. And so we're advocating that, hey, support us, let's do our evaluation. But there's a unique funding that this year from the Shakopee Metawakan Sioux community, from their Seeds of Native Health, they've actually created this partnership where they're the first to support us, and they challenge other funders to support our work. And so it's going to be an amazing year, and I'm very appreciative of this funding that's going to come through. And the funding that we're really using the money for would be the tax compliance issues, continue the partnership with our executive branch, the legislative branch, the Navajo Nation Tax Commission, to ensure that we are, and also that the tax is being collected, the most revenue is being collected, and also that the stores are not charging on healthy foods. And so there's many different aspects that we're now uncovering organically, and also being a part of the conversation is something that's very critical for us to be exposed to, that as community members, we're able to sit at these different tables with the executive branch and with these different departments, and we're teaching the youth to be a leader without a title. And we're sitting there and we're changing that conversation, that dialogue, and it's something that some people agree with and some people don't. And so for us, we know that a small group of people can change the world. And no matter what we go through, no matter what happens from this work, and there's a lot of opposition still. The multi-billion-dollar industries have recruited our Navajo people to lobby against us. They paid our leaders. They've tried to create clean water systems in different areas, trying to get their votes, and even just recently giving them scholarships, sending them to leadership camps, inviting them to these areas, and we're in a big fight. And so it is not something that is easy. It's something, that us as advocates, that we operate from the posture of our heart, because that's the only very critical thing that sustains us, and as well as our communities. And so some things, some challenges just to consider is making a history for our future. And I've heard that with different panelists up here, that we're able to create this change. And Mr. Tom, what's his name, Morris? Mr. Morris from this morning, he said that to think of in terms of millions, and he said, he thinks in terms of thousands, and I don't even think in terms of dollars, I think in terms of cents. And also I really like Michael Met. He said, the lack of resources creates innovation. And we didn't have an excuse. We continued to find solutions. There's no roadmap. I mean, even to this point, we didn't have a toolkit. And Denisa said, what do we do now? I said, let's try something and continue to, pursue the solutions. And we failed 99% of the time, but we got right back up, continue to do so. So all day I've been hearing rule, right? Rule. It's like something that, that I don't hear very often, because I am rural. I am, the rural people. But the more and more I thought about it, and because we have different issues that we're still being challenged by food justice, by social justice, by language justice, all of these different issues, environmental justice. And for example, our federal government still owns our land. And so, when I think about rural, R-U-R-A-L, for us as Indigenous people across Indian country, it's residing under reservations and leases. That's what you've exposed to me today, and I thank you for that, because many times we're not talking about rule, and we're not talking about, the discussions like you've had today. And so really challenging all of you to create new roles in society, to create those relationships with community members, to support them, and also enable them to take leadership in different aspects and give them a purpose when they don't have a purpose, and also to help us to reclaim our identity through healthy food, and also to change the narratives. And how many communities, all of you, can agree to change a narrative from being a victim to being a victor. And also for us to, to advocate for data sovereignty. I always say, that data travels at the speed of trust. And through all of our work, we've had different community health assessments being done. We've had, amazing work, and hopefully more research to come from our Indian country, from the Navajo Nation. And it's something that we're fighting for, is data sovereignty. And so in my last words here, whether we're talking about CRAP, which I always bring out, crap. People said, Denisa, don't say that word. And I have to say it, because that's my work, CRAP, carbonated, refined, artificial processed foods. I have to say it. So I hope you guys all cut the crap, and I hope you eat more food, FOOD, F for fresh fruits and vegetables, O, organic lean proteins, O, omega-3 fatty acids, and D is to drink more water. And also one of the ladies talked about PhD, and I challenge you to pursue a personal health decision, okay? And also remember that we pass food trends to generations, and remember that fast food, we also are passing through the values of being fast, cheap, and easy. So as you consider all these challenges, and really looking at your relationships with food and policies, that we also highly need to consider creating effective policy solutions, and also interventions. And also, most importantly, what I haven't heard today is improving Indigenous public health systems. Because how we do things is very differently than how the rest of the world operates. And this is my message, that we have a model for Indian country, that we're focusing on community advocacy, tribal sovereignty, creating economic development, returning to traditional food sovereignty, creating sustainable community wellness projects from our own money, recycling that, and also creating a successful restoration, that we the people are going to be healed, that we can move forward and help our people to be empowered, and also to encourage other women to step into leadership roles. For me as a Navajo woman, my community and where I come from is a matrilineal, matriarchal society, that women are the ones leading, and yet we don't see that reflected in our own government. And so I am an advocate for that I'm able to stand here and able to intervene and also to advocate. So we know that there are solutions through food. We know that we have a global problem rooted in the community members, that the solutions are also there too. So I continue to look for partnerships, and also learning how to leverage and also to exercise servant leadership, that, to lead, that we have to serve first. So I appreciate all of you, and thank you very much.